Hi, I'm Christina. I'm the lead hygienist here at Dublin Dental Care. Welcome to our Dental Hygiene Wednesdays. We want to thank you for joining us today. Every week we like to cover a topic that our patients are interested in or have asked us about. That way we can give you the information you need to help take care of that smile that we all love to maintain and keep nice and healthy and white. Last week we covered occlusal guards and why they're so important and what the use for them is when it comes to clenching and grinding your teeth. If you missed that video, it is up on our Facebook, our Dublin Dental Care Facebook page. You feel free to check that out. You can get some nice new information on occlusal guards. This week we are covering toothaches or tooth sensitivity because February 9th is actual National Toothache Day, so we thought that this was fitting. So I just wanted to go over some things that can cause toothaches and then ways to help that area out and help keep the toothache down or maintain the tooth so that you don't have those issues anymore. A couple of areas are on here. We'll go over some of them, probably not all of them. But one of the things that I hear a lot of complaints about when it comes to the teeth and being sensitive is after you start whitening. You can have sensitivity with that. And that is due to when you're whitening, you're opening up the tubules that are inside your tooth. So you're taking it, they're opening up, and there's liquid that's inside. So when you're whitening, the liquid can move back and forth, which can cause sensitivity. So in order to help take care of tooth whitening sensitivity, we recommend using a Sensodyne toothpaste, which is made specifically for sensitivity. Or we also recommend, if that's not working, using ClinPro. This is a prescription toothpaste that we sell here at the office, or you can even get at the pharmacy. It just has more fluoride, so it helps keep that tooth nice and strong, and it closes those tubules off so you don't have that liquid moving back and forth, causing that sensitivity. Some other things that can cause sensitivity are if you have an old filling that's been in your mouth for a while and it's starting to open up around the edges of the filling and you're getting leakage underneath it that's causing possible decay. That can cause sensitivity, or even if you have a spot on your tooth that is decayed, you can start having sensitivity because part of your tooth is broken down and it's starting to get towards the inside of the tooth, which is really sensitive. So when it comes to those issues, the best thing to do is to call our office and let us know what's going on. We can set you up an appointment, and Dr. Pignano would love to see you and help take care of that sensitivity and treat the pain any way that's needed, whether it's a new filling or actually filling the cavity that's starting to form that wasn't there before. We would love to have you in our office so we could get that taken care of. Another thing that can cause issues are poor oral health. If we're not brushing, flossing the way that we need to be doing, then your gums can get irritated and inflamed. And when they're inflamed like that, you start having some bleeding. Your gums can start being achy. It can even start affecting the tooth if it's sitting there long enough and you're allowing it to last long enough. So that's where you come in with your awesome oral health care at home with your brushing, with your flossing. Dr. Pignano loves the stimulants. So those are all things, if maybe you're not sure you're doing them right, when you come into the office, you can ask us and we can show you the proper techniques and how to use them at home so that we're making sure that you are taking care of your gums the way you need to. Another big thing that can cause tooth sensitivity or an ache is if your root is exposed, whether it's from grinding or clenching or brushing too hard, which is also something to be aware of while doing your oral hygiene. This is going to cause some sensitivity because your roots are very sensitive. They can actually be broken down and get a cavity a lot quicker than the enamel or the top part of your tooth that you see. So it's really important to make sure that if you do have root exposure, you're keeping that area clean. So when it comes to sensitivity, some things that you can do to help with that are, like I said before, using our ClinPro toothpaste, or we also offer topical application of fluoride, which is awesome. It's like a vitamin for your teeth, so it helps keep them nice and big and strong. So that's also an option. We just paint it on your teeth and it actually goes over the root and your tooth absorbs it, and it slowly releases the fluoride over time to help maintain that nice healthy tooth. I want to thank you for joining us today. Hopefully you got some information that can be useful for you, and we want to ask you to visit us every Wednesday and watch our videos. We try to cover nice, new, fun topics every week. And if you have any questions or you want me to cover a topic, you can email me at Christina@DublinDentalCareOhio.com. Thank you. Hey guys, just want to remind you of our awesome giveaway we're doing this quarter. It is called Fly Away With Us in 2017, Escape the Cold. So what we're doing here is when you come and visit us, you're going to receive one of these nice, cool stress relief airplanes. But what we're doing is for every referral you give our office, we'll put your name in a drawing. And at the end of March, we draw one lucky person's name and they get a $750 voucher to fly Southwestern wherever they'd like. Send your referrals and hopefully you can win this awesome prize. Thank you.